If you only have one ventilator and the two people, who are you going to give it to? And how are you going to decide?
It's here at Montreal's Jewish General Hospital where 26 patients are in the ICU with COVID-19, most of them needing ventilators to help them breathe. Right now, there are 53 to go around. But what if there was an increase in the demand for treatment and frontline workers had to choose who gets one and who doesn't?
The groups in Italy or even New York were kind of lambasted with this, and things happened all at once. And as a result, they're really reacting to circumstances. We have an opportunity here where we can plan as opposed to react.
Dr. Timothy Christie, a medical ethicist from New Brunswick, is urging Canadian health authorities to do that planning now. He says the country is not yet in that situation. Prime Minister Trudeau saying more ventilators are on their way. And in Quebec, Premier Legault saying we have enough ventilators, around 3,000. But Christie says in a pandemic, authorities should develop ethical guidelines to identify the people they'll get the best results for, to avoid situations like in Italy and in New York, where doctors had to choose on the spot. The Washington Post reported some hospitals in the U.S. are considering universal do not resuscitate orders for coronavirus patients, so doctors and nurses don't have to prioritize who lives or dies because of lack of equipment.
We could be putting people on ventilators for whom we're not going to change the outcome. We could be giving resources to people that we're not going to change the outcome for.
He says to consider an ethical dilemma, giving one ventilator to two people with COVID-19, a 13-year-old or a 73-year-old physician.
We can't use arbitrary criteria. So some people might say, well, the person's older, so give it to the younger person. And then the facts change a little and they say, well, the older person happens to be an infectious disease specialist who's working on developing a vaccine for COVID-19.
He says deciding factors shouldn't be biased based on age or intellectual ability.
We want to be as effective as possible, so we want to save as many lives as we can, but we can't use discriminatory processes to achieve that goal.
In Quebec, there is a committee in place working to develop guidelines for this situation. In a statement to City News, the Ministry of Health and Social Services says, obviously, we are also working really hard so that such guidelines will never have to be put to use, but we have to prepare for every eventuality.
It's better to do that hard work now than when you're under the pressure of real time situations.
In Montreal, Alyssia Rubertucci, City News.